So let's discuss bioethics and mental illness and some of the bioethical concerns and considerations when we talk about individuals that are considered mentally ill. We'll start with the definition of mental illness. What exactly is it? And there's a lot of definitions out there, but we're going to use the National Alliance on Mental Illness definition, NAMI, who defines mental illness as a medical condition that disrupts a person's thinking, feeling, mood, or ability to relate to others, and obviously to function on a daily basis. The current statistics on mental illness in the United States is that 1 in 5 individuals are diagnosed with some type of mental illness. Globally, that number is slightly different, and partially because diagnosis is not such a big thing in other countries. They aren't usually diagnosing individuals. So for all intents and purposes, what we're going to talk about mostly today is those instances in the United States and how it's diagnosed. Currently in the US, it's the second leading cause of death, believe it or not, and in other countries, it's the second leading cause of disability in all developed nations. So we think about that as a whole. It is predicted that in 2020, it's going to become the leading cause of death in the United States. So it is definitely something that we have to talk about and things to consider. So let's talk about how it's diagnosed and what these diagnoses are. The American Psychiatric Association, or APA, is a governing entity that publishes the Diagnostics and Statistics Manual of Mental Disorders, or the DSM. And that serves as kind of the standard for all doctors to be able to diagnose mental illness. So there's a couple of categories, obviously some very basic categories that are there for us to discuss. So I'll give you a little bit of insight into what each of these categories that DSM has placed out there for mental illness. And the first of those is anxiety disorders. And a lot of you may have heard of certain types of anxiety disorders. The common ones are panic disorders, and then of course the post-traumatic stress disorder that is associated with war or times of hard stress on an individual. So those are ones that we've commonly heard of. Personality disorders, some of you may have heard of, some of you may not. There's a lot of different personality disorders, and some of the personality disorders that are in here also fall into other types of disorders that we're going to talk about. So some of those personality disorders are like antisocial personality disorder, some types of phobias in terms of interaction with individuals and things like that. Schizophrenia personality disorder is one that is, like we said, that would maybe kind of branch several of the disorder areas depending on the type. And there are different versions of these kinds of personality disorders. Mood disorders are more common in the news. We see a lot more of these more often, especially when we talk about things like depression. Depression falls into a mood disorder, and bipolar disorder, which bipolar disorder has become more and more prevalent in the population, or at least more often diagnosed, and it's a combination of depression and episodes of mania. Dissociative disorder, these are what we traditionally would call multiple personality disorder, or those that have derealization. Impulse disorders, impulse control disorders, are things like anger management, pyromania, kleptomania, and those kinds of things where there's sort of a addiction attached to it in some way. Psychotic disorders, this is where schizophrenia shows up yet again. It's a personality disorder, but it's also a psychotic disorder. And schizophrenia, and I want to talk about this just for a second, is not what we always have considered in the past. There's a misinterpretation of this, that it is a multiple personality disorder, and it's really not. Schizophrenia is actually classified by psychosis as individuals who see hallucinations or hear hallucinations, things that seem very real to them but in fact are not. So psychotic disorders falls into that. And then our last one that we talk about is somatoform disorders, and those are all what you see here. They are eating disorders, something like bulimia, anorexia, sexual disorders, sleep disorders, and then also hypochondriosis falls into this as well. These are somatoform disorders. The actual definition would be thoughts about the body, unusual thoughts about the body. So these are the different types of disorders as they are defined by the DSM. And so this is how doctors and medical professionals would diagnose an individual with mental illness, is by looking these things and looking at the definitions of what these things are. Now, substance abuse is not considered is not included on DSM. It's not considered a mental illness. However, substance abuse can exacerbate the signs of mental illness and can lead to it if there's excessive use. So let's talk about a historical perspective, individuals that in the past were mentally ill or diagnosed as such. Pre-1960s, so prior to the 1960s, people with mental illnesses were oftentimes institutionalized. They were sent away. They were forgotten or hidden because they were not really accepted by society. It was not, it was very, very made you much of an outcast if you had someone in your family that had a mental disorder. So they were usually hidden. They were hidden from view. They were taken to an institution and they were hidden away and forgotten about. Poor conditions existed within these institutions. It was actually, the conditions of the institutions were very rugged. They didn't have proper access to water, didn't have proper access to cleanliness. So they were very, very kind of sad, scary places to send somebody. And what would happen most often is that the patient would experience a complete and total loss of rights once they made it into that institution. They were committed involuntarily and most of the time for life. There was never a chance of them coming out. And once they were institutionalized, the medical boards at those institutions took over them, took over their life. They were subjected to all kinds of treatments. Treatments could be medications that were new and untested, so they became sort of like guinea pigs. Things like electrotherapy, convulsive electrotherapy, shock therapy, things that we've heard about. They were put into induced comas as forms of therapy, sometimes diabetic comas and things like that as means of trying different methods. And then lobotomies, which were some of the common types of therapies that were there. They were given no control over their life at all, no autonomy left. They were forced to extreme conditions. Some of them were forcibly sterilized because they didn't want, obviously, any reproduction of these people. They were subjected to medical research without their consent. So it was a very, very tough circumstance for individuals that were considered mentally unstable. In the 60s, JFK, John F. Kennedy's administration, the presidential administration, he came out and passed the Community Mental Health Centers Act, which led to this deinstitutionalization, meaning all these institutions were slowly shut down. And part of the reason for that is that we were seeing in the 60s lots of things about civil rights, women's rights, and so this led to the onset of patients' rights and what can we do and what can we. And what came to light was this terrible conditions in these mental institutions and the mental illness patients were subjected to. So they were treated really poorly. Many had started to really kind of be aware of this, and they saw that they had no say about their mind or their body and this complete loss of autonomy. So bioethics in these days in the 60s started to really become important, started to challenge these ideas and tried to start changing and protecting and helping those mental illness patients. And JFK, who had some firsthand experience with this, he had a sister who was given a lobotomy because of one of these mental illness conditions, and so he had this real firsthand experience with poor treatment of mental institutions, and so he had a heart for trying to make a change. So he passed this Community Mental Health Health Centers Act, which basically closed down the institutions and helped to set up community centers where people could get care. And so he was trying to take it from being a personal thing in a family to being more of a community-driven event. And so he's sort of the forefront of bringing on more awareness to this. Now, the modern perspective and what's currently out there in terms of institutionalizations and community involvement is there have been a number of laws that have been passed that make it the community's responsibility to provide care to these patients and to help them be more autonomous about it. And sometimes this is an adequate solution, and sometimes we find there's a lot of inadequacies here. There are some of the laws that limit what's called medical paternalism, which is taking the power from the doctors and the government and deciding what's good for a patient and giving it back to the patient, so giving back some of that autonomy, which is fantastic in some respects. There is very little involuntary commitment allowed anymore. Involuntary commitment is only allowed if a judge will determine that the person is in imminent danger to himself or to others. And then once they have made that involuntary commitment, they have to revisit it. It is not a permanent long-term commitment. The judge has to come back months later, reevaluate how it's going, and determine if there's longer term needed, and so on. So it has to be constantly updated. Some other things is people with mental illness have the right to refuse treatment now. So again, more of that autonomy that's given to them to make a decision. And they also have a right to treatment in the least restrictive environment. And so that could be anything from their home to a halfway house to a family member's home. So an area that's a restrictive environment means that it is now a place where they have chosen, a place where they are comfortable, where there isn't anyone forcing things to happen to them. Now, the downside of the deinstitutionalization of the masses, and where it is more of a community involvement, comes when there is not access, when there's no access to health care or no access to areas where there's community treatment. And so those individuals struggle with treatment and become homeless or end up in jail. And it is a statistic out there that in the U.S. we have seen an increase in homelessness of mental illness patients as a consequence to this deinstitutionalization. So there's good and there's bad to every type of ethical situation. So some of the ethical concerns, some issues that are associated with mental illness is patient autonomy and competency. So there's a question I have for you to think about is how can we feel confident in a patient's decision-making abilities if they are not mentally stable? So those are some questions that we have to ask. And then of course we have to find out, do the patients have the right to refuse the treatment? Should they have a right to refuse treatment if it's going to make them better? And how does our perception of people with mental illnesses that are violent, that have violent tendencies, how does that affect patients' rights? So if they have violent tendencies, should we take it over or should we allow it to continue? And then some other things to think about is confidentiality and privacy. Of course, should healthcare providers be forced to reveal what a patient tells them during times of treatment? And second to that, should employers know if there is a person that has been treated for mental illness and what those treatments and stuff are? And then, of course, in the mental health care system, how do we lessen the stigma of mental illness? Many people don't get treatment because they're afraid of what that's going to mean. They're afraid of what stigma is going to be carried with them wherever they go. So how do we lessen that stigma? And then of course, how do we ensure adequate funding for access to mental health care? Because of course it's got to be funded. There always has to be money involved. So these are all circumstances and situations that are arising, and these are bioethical concerns. Now from a global perspective, and I want you to take a few minutes after this is over, there's a link underneath the video to the World Health Organization's mental illness website, and you see right here on the page that I've taken a snapshot off, the WHO provides support to countries in developing and implementing progressive mental health laws that promote and protect the rights of people with mental disorders. So their goal, the WHO, is to try to help others in other countries to set good standards for mental illness so that they can start making that awareness prevalent elsewhere, not just in the United States, which is of course what we've been focusing on. So you'll see that, and then you'll see, unfortunately you can't see it in this photo, but down further there's even more links to regional human rights from the United Nations. So if you want to take a few minutes to take a look at that. Now I clicked on that first box there, the mental health and human rights fact sheet, and took a picture of that and put that here. But that's something interesting that you might want to read. It's a single page document, but it is the WHO's fact page that gives a little bit of insight to individuals in other countries that are looking for some kind of help. There's a checklist that can be designed and developed. So the United States has obviously one stand, and we do have global concerns of this mental health and the bioethics that are associated with that. So take a few minutes when the lecture is over, take a look at the WHO's website, maybe take a peek at what the UN is doing, because there's other policies that we want to discuss, and there's other policies out there that we should probably start looking at. Maybe our particular view in the US isn't the strongest, since there are some goods and bads. So I hope that helps, and I hope that you are able to get a chance to get a glimpse into some of the ethical concerns of mental illness.